So, hello everybody, this is Natalia Marmol, co-founder of Venevia Health. Following a series of interviews with doctors, specialists in the treatment of neurodevelopment disease, today we have the great honor to have here Dr. Nicola Antonucci. Welcome, doctor.
Good morning. Thank you for inviting me and have the opportunity to share my experience.
For those that don't know Nicola Antonucci, this is if this is even possible. He has a degree in medicine and surgeon at the University of Bari, Italy, where he specialized in psychiatry. Since 2006, he started studying and working with biomedical treatments. Since 2006 until 2012, every year he attended the annual scientific meeting and medical training at Autism Research Institute. And since 2012, he participated in the annual Autism One conferences in Chicago. Nowadays, he's the director of the Biomedical Center for Autism Research and Treatment in Bari, Italy, where he meets Italian and international patients coming from more than 30 different countries. He has published several works on international peer-reviewed journals in the field of autism. In 2010, he initiated a collaboration with Dr. Dario Siniscolo, creating a research group to study molecular and cellular changes in autism. In 2013, he worked in collaboration with Nobel Prize winner Professor Luc Montagnier regarding chronic bacterial infection in autism, and he has also studied and published about molecular pathways involved in oxidative stress and inflammation in autism spectrum disorders. I had to cut short his CV, but it is really impressive. If anyone would like to read the full version, you can go to his website, which is www.antonucci.clinic. So now, to start with the interview, I'd like to go back in time to those years where you didn't know, or at least say you had limited amount of information about autism. How was it for a conventional psychiatrist doctor to transition into the world of biomedicine, doctor?
Actually, when I started to work with children with autism, I really didn't know exactly what it was autism. I mean, I just studied at university about autism like a mental disorder, so something that can be treated like schizophrenia or depression. You know, when you use in medical practice the word disorder, means something that have no medical base. You have no biomarkers, you have no tissue organs that have some abnormalities. So it's something that seems coming from nothing. Or most of the time, what is underlying this kind of disorders, it's the psychological problem. So autism, like schizophrenia, is still considered a psychological disorder coming from bad family background, and or at least from genetic approach is coming from bad genes of the family. Okay, that's what it's not autism. That's what I learned, especially my experience in USA, where I really opened my mind. They completely changed my perspective. I was a fan of psychotherapy, of psychiatry at the beginning of my experience. Then I completely changed the approach. So autism is a disease, so it's a medical disorder, disturbance we have, and which is not just affecting the brain, but it's affecting all the body of children, because the children have also allergies, they have chronic gastrointestinal inflammation and problem in the gut, they have eczema, they have several other disorders that cannot be just a disorder in the brain. They cannot be just justified with psychology. Psychology has nothing to do with children 2-3 years old. So I want just tell this because I don't want the parent that already have this incredible level of problem with children. They feel also a sense of fault that is something wrong in what they did when these children were so little and young, and maybe something wrong. It's a medical disorder, so it needs to have an approach as all the other medical problem that we can face in medical practice.
So would you say, doctor, then, I'm jumping a couple of questions I had prepared, but would you then say that autism is a medical condition and therefore treatable?
Yeah, that's what I meant. It's a medical condition. We have some biomarkers that we can check, and there are something specific you can do. Not just working on the brain, but working in the child as a whole organism that have something wrong, especially in the immune system and the metabolic system of, for example, detoxification, of inflammation. So it's something that we can do and we can treat. And so what I can say, what is autism, my experience, what I learned these years, it's more encephalopathy. So it's the brain is suffering because multifactorial problems are coming from the environment and are affecting the brain development. So it's more an environmental disease. It's coming, for example, from overwhelming toxins from food, from other chemicals in the environment, heavy metals, pollution, electromagnetic waves, all these factors. Something changed in the last 50 years that is increasing the level of toxins. And we are more and more living a toxic world that is not allowing the brain of the children and the immune system of the children to develop in the right way. So many of them are suffering and blocking the development.
Okay. So let's say for the people that it's familiar with the autism world, they know that each doctor has different approaches to, let's say, treat the core symptoms of autism. So could you tell us, just to start from the beginning, what is your approach to treating autism? What are your main fields in which you would treat those children or even adults?
Yeah, I have a kind of approach of layers of onion, you know. There are, when you have a child, you see immediately there is some symptoms that they are more significant, more important to treat. If you have in your office, first you see first-time child with severe hyperactivity, aggressivity, the parents are destroyed by sleeping problem. You know that you have something symptomatic to treat, okay? And so calm down this kind of overreaction of the brain is already the first approach. Or you see a child with already clear severe gastrointestinal symptoms, which is that they are not very rare. Actually, some researchers say that 80% of children with autism have gastrointestinal symptoms. So even sleeping problem or aggressivity could be a sign of inflammation. These children are not just crazy, they are suffering. The most of them, they have a high level of pain in their body, and they are reacting as they know, because if the most of the children cannot speak, the way of communicate their discomfort is behaving in a not proper way, and especially aggressivity is a sign of pain. It's like they feel attacked inside their body, so they react attacking someone else, but because they feel something, and they don't know from where it's coming, this kind of pain of. So first approach is see which kind of symptoms they have. Of course, I ask patient or some patient to have some also medical test, blood test.
What type of test would you recommend?
I really start even before my first consultation with very basic tests like blood count cells. So just to notice children have anemia, iron and ferritin low. Vitamin D3, for example, is very basic test in my experience, because it's enough to have very low and deficiency of vitamin D3 to have a block in development of the children, to have mental retardation. The same is important with thyroid. Children with hypothyroidism, they have mental retardation. So already just going to fix this problem in some children, they have already a step forward in their development. We check for chronic inflammation like erythrosedimentation rate or streptococcal antibodies, which is a sign of a chronic infection, and sometimes even a sign of immunity. So we know the pandas of the Nasal are coming from some chronic bacteria. I'm checking for homocysteine, which is a marker of abnormal impairment of methylation pathway, which is a very important metabolic pathway in the children, to help for detoxification of toxin from the body, or even to produce transporters of energy in the brain. I'm checking also kidney function or the liver function, and some of these markers seems to be, for example, liver function seems to be markers of the liver, but can be also markers of muscles, so give also some information about mitochondria. So they are very basic. Every doctor can prescribe, and you can do in any local laboratory. Then during the consultation, if I have clear signs of gut inflammation, then I can do some fecal test like microbiology profile of to scan which kind of maybe pathogens these children has. Okay, we know a lot now. We are studying a lot about microbiome in the most of these diseases, and in the autism, that's very important to do.
May I ask, just going to the microbiome, what type of test would you ask? Would you recommend like a PCR testing? Would you recommend metagenomic testing? What, just so the families know, for example, what is it that you value most?
Yeah, PCR testing for stool, they are still very expensive. I try to do something more easier, even just bacterial, yeast, clostridia cultures. Okay, I usually, and you can spend just 100 euros for this test, even in your local laboratory maybe. I use one Italian one, which is very, very useful for my medical practice. I mean, they find something that I treat and see improvement. Okay, I use some American laboratory like Dr. Data. Just culture. I don't need to know, because if we found just a few copies of PCR by PCR of some bacteria, which is not really significant in the, we can have very bad bacteria, but they are just sleeping. Okay, so they are not causing the symptoms. So I don't need very complex tests. And then to address the treatment, it's very important the clinical symptoms of the children, because each one of these pathogens that we can have in the gut can be easily recognized from the behavior. For example, I never test for parasites, because the parasites is very difficult to find in the stool. We cannot find anything, and then maybe we are missing a good treatment. Typical signs of parasite, it's children that are putting object in the mouth. So, because that's a behavior induced by parasite to continue to live in the kids, in the children. So it's like induced by parasites producing some special toxins that affect the brain, and ask to the children to put the object in the mouth. This way, they are taking other eggs from the environment and continue to infect themselves.
How can you break that? So would you say that deworming the children will stop? Because this is a very common sign of the whole.
And also very dangerous behavior, because most of children intoxicated by lead usually come from this behavior to put plastic object in the mouth, which usually release a lot of lead. So it's almost, I cannot say 100%, but 90% treating parasites remove this kind of behavior. Other symptoms of parasites, for example, putting grinding, the bruxism, or a sleeping problem, especially waking up during 3, 4 in the night, especially during the period of full moon. So if children get more agitated, sleeping worse, and more stimming during the full moon time, that's typical sign of parasites. Okay. So in this case, I have very clear information about parasite, and then what you can do also on the blood, check for eosinophils and IgE, which usually are high in chronic parasitosis. So we don't need stool tests for this kind of, even very common, it's understand when children have yeast chronic problem, Candida or Aspergillus. There are several species that can affect the gut of our kids. because when children start to laugh without any reason, they are very euphoric, very hyperactive, especially after eating refined sugars and even carbohydrates, even soft drinks or biscuits or pasta. That's a typical sign of yeast fermentation in the gut, because yeast use the carbohydrates to ferment in ethanol, and they became like drunk. So children that looks like drunk, they have chronic yeast infection, which is producing a lot of toxins and make children with mood swings from euphoric and then dysphoric, so, aggressive and tantrums. So, and even sleeping problem is coming from this. So this is another cluster of symptoms that can also identify this biotic problem without doing stool test. But of course it's important, especially for family, to identify in laboratory test this problem. So sometimes I used to do more for family than for my clinical approach, some tests. Because they want to be sure that what you say, what you're doing, that's I understand. It's right. It's correct to do.
What's your favorite way of testing for parasites? Because there's a bit of polemics here, right? So there's people that say, again, you test in the stools, they might not appear. You look in the microscope, they might not appear. You look PCR, they might give you false positives. So what sort of testing do you think is most appropriate?
At this point, if you want to do that, I think PCR for parasites can be the more resolutive test. But as I repeat, I don't do that for parasites, because just 3-4 days of treatment with a very simple molecule like mebendazole of palmoate, pyrantel palmoate, which are not absorbed. So you take orally and they go away with stools. They can solve the problem in just 3-4 days. So it's a very safe, very effective treatment. They have any consequences on the body and very well tolerated by kids. There are some countries that they are doing this kind of cleaning of parasite in the gut periodically. So that's a very safe procedure. Usually it's more, let's say, a clinical test, a clinical laboratory test, because you do the treatment, the children get better, you have the confirmation that the parasite is a problem. And if this situation is appearing again after 2-3 weeks, you can repeat again. Actually, it's important to repeat every 14 days, at least the first 2-3 times you are treating parasites. And
you would do it fully following the moon?
If we are done just a week before the moon, I will not do during the moon because I'm already treated. Okay. That moon would be fine. That period of moon would be fine.
Okay. And so following more testing, what about, for example, heavy metal, like hair testing?
Yeah, exactly. So from one side, if you want to just suggest very basic tests and people that have not so much money to spend in test, I would suggest blood tests for check for, chronic inflammation and some metabolic deficiency. And then air test is another very easy test to do. It's not invasive, it's very cheap. Because heavy metals intoxication, it's very common in our kids. I think I test more than 200 kids using porphyrin test, which is a metabolic test on the urine. And 66% of children were positive for heavy metal intoxication. And porphyrin test is not very sensitive test. So I think there were also many false negative. So the test said it's false, but maybe they are also intoxicated. So that's very common. Intoxication with metals is coming especially from food, especially from fish consumptions, and from usually with amalgams of the mothers filled of mercury. And that's another important problem that unfortunately now they are not using, dentists are understanding that this is a medical problem, even for them, to manage mercury every day in their office. And they are not doing anymore. But in 1980, 1990, 2000, there were still a lot of mothers having fillings with mercury in their teeth. So I've seen my experience mothers with already 2 black fillings in the mouth have children with chronic intoxication. And the air test is good to show how much mercury and even aluminum, arsenic, lead is coming out for these kids. It's not the most sensitive test because some children, if they have severe problem of detoxification, which means that their metabolism are not able to release in proper way all the toxins, they could not have anything coming out from the hairs, which doesn't mean that they are not intoxicated. It's very likely that it's accumulated in the body, in the tissue, especially in fat tissue like the brain. So in this case, the most effective and sensitive, even if a little bit invasive test, is the provocative test, which means use medicine like the MSA, the MPS, DTA, to provoke the release of metals from the body in the urine. So you collect urine and see how much heavy metals are coming out. And the best test for sure is IV provocative test. I used to put in the venous ADTA, the MPS, because the MPS is very specific for mercury and ADTA is more for lead. If I use ADTA, the MPS oral or suppositories, and I will not see how much lead I have. Why? In this way, in just one session, you put both the medicines in, and if there is lead, I will see lead. If there is mercury, it will come out as well.
Are you not concerned about redistribution when you do the test?
I think this is a false problem, this redistribution. I don't know why this idea of metals that are going from one tissue to other tissue is making so much concerns, especially parents. Because when you give chelators, medicine that catch the metals, they are especially coming from the blood and from a kidney. Okay, so if you have 100% of mercury in the brain, 100 in the blood, let's say that after a session of infusion of oral chelation, you will see that in the blood coming lower, let's say 80% in the blood, and then there is a movement of heavy metals from the brain to the blood. So will be then 90 here and 90 to blood. So in this, let's say, redistribution, the brain is getting better, is not getting worse. Okay, because we are reducing the level of heavy metals from the other tissue. All the tissue will feel better. I think that when we have side effects with chelation is another kind of problem, and that is happening especially with chelator which contains sulfur, the MSA, the MPS, and alpha lipoic acid, which is more supplement than chelator. What is the problem? All the product supplements with sulfur, they are feeding yeast. So every time you use this sulfur medicine, the yeast are growing better, and the children became more euphoric, hyperactive, laughing without no reason, they don't sleep well, the stool became yellow, diarrhea. That's what is happening when you have problem with yeast. And most of children with intoxication, they have problem with yeast because yeast are growing where there is a immune system depressed by heavy metals. So we say that yeast are opportunistic pathogens. So they grow when they have opportunity to grow. So, and in children with autism, they have very big opportunity. So giving this medicine with sulfur is like put petrol on the fire. Okay, they have a flare of dysbiosis. So if you have this kind of problem, you have not fixed gut dysbiosis, and using this medicine, they will get worse for a while at least. So it's important, and that's what I do in my experience, that every time I'm using this kind of chelators with sulfur, to give also antifungals, even if long-term treatment of antifungals. For some children, antifungals is one of the best treatment ever to calm down behavior, aggressivity, increase attention, learning, focus, and that's good. It's very safe. There is not. I mean, let's say pharmacological antifungals. I don't see the same effect, especially during chelation, using grapefruit seed extract of a golden seal or other natural antifungals. Okay, so that's my idea about redistribution. And actually, every time I do this, I will not see a problem with behavior in the children. So I will not see this kind of what is called the distribution problem.
What's your opinion on the topic of chelation? So we know it's very popular anti-catalytic chelation, which is small doses, yeah. More enough.
That's very common and popular because they don't need doctors to do that. Okay, exactly. You can easily find on the market this medicine. That's why the reason why it's very, very, very common. But so, I don't like that for the reason why, because the children get worse using sulfur. Okay. And but for some children, it can be already very effective, especially children with problem with mercury. Mm-hmm. It's not affecting what I've seen. It's not very effective on lead. But I understand it because it's very easy to do. A common. I think that's the best way for most people that have not possibility to meet and be a doctor that can follow these treatments. But just be careful with this flare of gut dysbiosis. Yeah. So try to take care about that. So sometimes the children get worse, but which doesn't mean that it's not effective. It means that we are not taking care of the gut dysbiosis.
But what would you think about, so Andy Cutler, he talks about really small doses, and then when we're talking about usually intravenous chelation, so we can talk about, I don't know, DMPS 50 milligrams, I think, towards 0.5 or 5. That would, so why is that difference in the quantity of the substance that it's given?
Okay, I'm not using very high dose of chelators IV, and we cannot really compare, let's say, what we need for using the quantity we need for DMSA with DMPS. For example, DMSA, let's say the classical standard dose is 10 milligram per kilo, while DMPS it's 1, 2, 3 milligram per kilo, because they are different molecules, so we cannot really compare the quantities. And actually, I'm just using 1, maximum 2 milligram per kilograms IV of DMPS. And why? If you use very little dose of DMSA, that can be effective, but very long term. It takes a long time, and maybe you are suffering for a long time for dysbiosis problem. Okay. While IV chelation with the right dosage is not, because it's bypassing the gut, so you don't need to give something oral that is going to feed the yeast. It's less invasive for the gut inflammation. That's the main reason why I prefer IV chelation. And then, if you have a problem with lead, you have to use ADTA, and you can use that only IV, because the quantity of sodium, calcium, sodium ADTA that you can absorb orally, it's less than 5%. So oral ADTA can reduce the quantity of new toxins coming in the body, catching everything is in your diet, but is not able to go in the tissue and catch the lead, which is usually accumulating in the bones. And you need something that is passing the gut barrier and going in the tissue. And that's why ADTA, it's not, you have no problem with yeast with ADTA. It's very safe. The safest treatment for heavy metals is for sure ADTA. If you can do in combination, it's even better. Then you can put inside vitamin C, glutathiones, and make a cocktail of detoxification.
Could you, doctor, tell, for those people that actually doesn't know what we're talking about, could you just explain just a tiny little bit what is endovenous chelation and if it's all right to give to children?
I mean, what their chelators are medicine the name Chela comes from the branches of the crab. No, it's like they have a shape that when they see mercury molecules of lead, they do like this. They catch this molecule, and because they have they are hydrophilic, they are easy to go again from the tissue in the blood and go away with urine. So it's they are molecules that simply help the body to release something that otherwise would be difficult to remove from the body, at least so quickly. They are molecules that you can find we can find in pharmacy in Italy, DMPS is registered in Europe. So they are not medicine that I discovered. It's just something that is on the market and that is used in normal mainstream medicine when you have people with intoxication, okay, by heavy metal. So it's a common medical practice that you do when you have a problem of intoxication. What people usually don't understand, why they have to make this medicine for autism, but you are not treating autism. You are treating encephalopathy, I mean, a brain that is suffering because coming from toxic problem. So we are treating children with intoxication. And so, and literature is full of also experience of doctors of children with mental retardation, which have problems like accumulation of heavy metals. So it's just a medical practice that you put in the same session, medicine, two different medicine, they don't interact with each other, that in the same session go in the body and remove these toxins from their body.
And that would be through an IV. So the kids will have a line in the arm, which will have a drip for a...
Yeah, that's usually is very fast. In 10-15 minutes, you can put make all the infusion. And of course, it's a child. Child will not collaborate so much to make it's the same way you make a blood draw for a test. But I mean, we are talking about a very severe disorder. We are not talking about how to treat coughing flu during the winter time. We are treating a children that if they don't do something when they are 3, 4, 5 years, 10 years, then you will have a chronic long life disability. They will not talk. They will not be able to be independent. So we have to find the medical reason why the brain is not developing, and try to treat them the best way. That's why we cannot approach like, let's say, homeopathy or something. Homeopathy it can be good for some symptoms, but we need to do something effective that can save the most of kids. Once you understand and you have a medical laboratory test, they show you that if you have problem with intoxication.
Perfect. So now let's go a little bit deeper into science. So, doctor, can you tell us about brain inflammation and microglial activation?
Yeah. So something for sure is happening in the brain, because if these children, they are not talking, they are not understanding or learning, something is affecting the brain. And when they did autoptic examination of the brain of children with autism that unfortunately died for other reasons, not for autism, for accident or something like that, they found in the brain these children what is called microglia activation. Microglia, they are inflammatory cells that we found normally in normal brain, that they are like sentinel or guardians of infection in the brain, of anything is try to make damage in the brain. Usually they are resting and they are just feeding the neurons to grow better. But when there is some information coming in the brain, even from the rest of the body, they became overactivated and chronically overactivated. They produce inflammatory substance and even an enormous quantity of glutamate, which is consequently overactivated the brain. Glutamate is very excitatory neurotransmitters, which make what is called excitotoxicity, a toxic excitatory chronic effect on the neuron that start to shake chronically, to be activated chronically, then they became completely exhausted and start to degenerate and die. But what is activating the microglia in the brain? The toxins that are in the environment. That can be activation of mast cells directly from lead of mercury, can be activation from a fragment of the wall of the bacteria, like it's called LPS. They are directly incendiary devices. They are really making the brain on fire. They are coming from pesticides. They are coming from messenger inflammation of chronic inflammation in the gut, like tumor necrosis factor alpha, interleukin-2. They found these cytokines, they are called, let's say, inflammatory messengers in the gut, and then we can find the same in the brain. Mm-hmm. There is another actor in this chain of crime, which is the mast cell. Okay, mast cell, they are the cells well known for allergies, but they are the cells that protect our body, or they are activated when some factor is coming from the environment in our body. In fact, the mast cells, they are all the surfaces of our body, of the skin surfaces, airway surfaces, gastrointestinal tract surfaces, okay, on the mucosa. So if in our, and Dr. Theoharidis, which is one of the most brilliant expert researcher in autism field about autism and allergy and mast cells, have explained very well in his papers this process. So when we are eating some food that contain toxins, including gluten and casein, mm-hmm. or we have toxins from Clostridia, bacteria, yeast, or heavy metals, the mast cells will explode, like exploding, releasing a dozen of different markers of inflammation. And when this level of markers is over a certain threshold, they can go in the blood and become activators of mast cells in the brain. Like they are communicating to the brain, something is happening in our body. You have to do something, okay? Mm-hmm. And the mast cells are then producing and directly activate them because they are close to microglia. They are activating the microglia. So they are the communication between the environment and the microglia in the brain. If we block the mast cells in the brain, even if we give toxins in the body, we will not have a microglia activation. There are very interesting experiments on mice about blocking mast cells and blocking all the process of the cascade of the brain inflammation. That's why it's very important to work on these mast cells, and working overall on allergies of children and removing toxins from children, which are activating mast cells.
So what tests do we have, or what markers would you use? You mentioned some about the cytokines, to know if a child has brain inflammation or not.
Actually, we don't have specific tests for testing the microglia activation and brain inflammation. We should do the biopsy of the brain, but it's not possible to do, right? We can, if we have a problem with the liver, we just put biopsy and we know if we have a viral infection, we have a problem with alcoholic steatosis and something else like that. But we cannot do that in the brain. Of course, if we have a high level of cytokines in the blood, in the body, like tumor necrosis factor, interleukin-2, we can say maybe these markers are producing also brain inflammation. We just know that something is in the brain, and this something should be for sure microglia activation. And actually microglia activation is not just a process that is happening in the brain of children with autism. It's a normal common process in several different neurodegenerative disorders like Alzheimer's disorder, amyotrophic sclerosis, and Huntington disease. So we have in common this kind of process. In fact, it's many of treatments that we can do in Alzheimer, for example, we can be very effective also in children with autism. And that would be interesting to develop this kind of research of using the same medicine in Alzheimer for children.
Going back again to what I said about the cytokines. So sometimes it's been, you know, you go to some doctors, they ask you to do a cytokine test, but then there is also the, you know, you wonder how reliable it is to take, let's say, a picture of that moment of the cytokines, because you don't know if 10 minutes later those cytokines will be giving you the same result. So would you think that it's actually a useful test to do, to look at the cytokines in order to know how the level of inflammation is, or that it's not actually, let's say, a reflection of the state of the brain?
Some of these cytokines are stable in the blood. There is not very high fluctuation during the day, like tumor necrosis factor alpha. And that's very common to find high. And that's a sign of chronic inflammation. Okay. So your doctor can say this doesn't mean that you have brain inflammation. But anyway, it's let's say it's alarming. You have to alarm the doctor to say that there is some process, can be autoimmune disorder, can be chronic gut inflammation. So there are different conditions that are producing this. And it's very likely that if you treat this condition, you are improving what is happening consequently in the brain. So for me, TNF-alpha can be very useful. It's very easy to find, can be very useful to at least open the eyes of the doctors to say there is some inflammation in the body.
Perfect. So on the same topic of brain inflammation, I remember a while ago, I watched your presentation on Autism 1 about brain inflammation and microglial activation. In that conference, you spoke about PEA. Your words encouraged me to actually look into the substance. So if you don't mind, I'm going to quote you from one of your conferences talking about PEA. So you said, PEA acts directly in the endocannabinoid receptors to downregulate mast cells and glial activation. When there is a brain inflammation, glial cells and mast cells increase the production of PEA and upregulate endocannabinoid receptors in an attempt to counteract and switch off inflammatory process. PEA is shown to have anti-inflammatory effects and neuroprotective. What else can you tell about this substance that seems to actually work so well in the case of autism?
Yeah, that's very interesting. It's a supplement, okay, PEA, which is working, increasing the production of endogenous cannabinoids. So it's not working directly on cannabinoid receptors, but is working on increasing this overproduction of molecules that counteract inflammation. So when we have some process of inflammation, let's say that we a bee, have a bite of bee, and we have a kind of redness, itchy, and it's painful. After a while, when the immune system removes the toxins coming from the bee, there is something that has to happen, which means start again, come back to the same level of normality than before. That's what it's doing, PEA. It's try to counteract inflammation and coming back to the previous state. So cannabinoid receptors are everywhere in our body, okay? All the cells of our body. So we can have it on the skin, we can have it on the gut, we can have on the lungs. In fact, PEA, they are using also to recover people from pneumonia coming from coronavirus, for example. But we have also in inflammatory cells in the brain. The only tissue which has no cannabinoid receptor is the neurons. So we don't have, this is not specific treatment for the neurons, for activated neurons, but is working on the cells that activate the neurons, especially microglia is full of these receptors. And so this is very good molecule to reduce overall the inflammation. And because it's also on surface of mast cells, This is a very good mast cells inhibitor. Okay, so if we have children with, for me, the best candidates for sure, children with chronic allergies, with autoimmune activation, they respond very well to PEA. What makes it special? This another product works very well with PEA is luteolin. In fact, Dr. Theo Aridis, which is the researcher working on mast cell activator, luteolin and PEA, they work very well to inhibition of mast cells, also inhibition of brain inflammation. What makes special this combination in this product, which is Italian one supplement, it's called Glialia, it's that they are ultra micronized. What does it mean? It means that they use nanotechnology to compress the molecules below 10 nanograms, so they can pass the blood-brain barrier, so have direct effect on the brain. Otherwise, if you take some PEA product without this process, they will not even be absorbed in the gut. So you have to make IV PEA to be properly absorbed, or you have to take a lot of quantity to allow a little percentage to pass the gut barrier, which would be easier if you have leaky gut. So because our children have leaky gut, maybe in any way it could work a little bit. But what makes special this product is the fact that it can pass the gut barrier, the blood-brain barrier. And Glialia, so what I've seen, my experience, they have anti-seizure effect, so it's working also in children with seizures. Anti-inflammatory, anti-pain, so children have chronic pain like headache, and they are always complaining something is bothering them. Mm-hmm. And they are working also on obsessions, stimmings, hyperactivity. Okay, so that's very, very easy supplement that can be very useful for reducing, calming down brain inflammation.
Okay, you just said something that I did not know. Many things I didn't know that you said, but the one from PEA about that if it's not micronized, it's not well absorbed. Yeah. I mean, a lot of people is taking PEA in different ways. For example, here in Spain, we find
if they don't see improvement, maybe it's not because it's not working for them, maybe because it's not properly absorbed. In fact, until the time that they started producing glia, all the researches with PEA have been done intravenously. So they were putting intravenously the molecules for animals, because we know that it's not properly absorbed. The researcher knows. But you see, now we find on the market a lot of this PEA, mm-hmm. And if they are not working, that's the reason why.
Is there in any way that can be tested if it's working? Any marker, anything that could give us an indication if there is absorption or not?
No, you have just to notice improvement.
Yeah, the problem is some kids take so many supplements that it's difficult to know when one is doing something. But
I usually use a very simple strategy to understand what is working or not. Just start one thing per time. Mm-hmm. Give 1 week, 5-7 days from starting one supplement and another new supplements. Otherwise, you are just giving a bunch of supplements. Maybe it will get worse and you don't know what is happening, but will get better and you don't know which one is giving results, or which one maybe you can continue, or which one remove from your
In the case of Glialia, would you think that this is a supplement to take for a long time?
Glialia, yes, can be a long-term supplement. It's very safe.
And about the luteolina, do you think there is any particular genetic mutations, or let's say, that could not benefit from having luteolina?
No, I don't think at the moment there is something polymorphism that can allow us to use or not use this kind of molecule.
So it's safe for everyone then to take?
Just to try.
Okay, perfect. Now, one topic that I've been asked to please ask you is the nootropics. Could you please tell us, first of all, just tell people that don't know what it is, and then tell us what's your opinion on them.
Yeah, nootropics are a molecule, can be medical molecule or can be supplements. They are working directly on the receptors of the neurons. So they are stimulating the neurons to develop, or they are increasing level of focus, attention. So they are giving, let's say, a good effect, working receptor on development of the neurons. Nootropics come from nous in Greek, which means brain, mind, and tropic means nourishing, to feed the brain with something that is promoting the brain development. It's like, in my experience, nootropic is like the second step. If we have a brain that is on fire because toxins, you have first of all remove all, fix your diet, fix your gut, removing heavy metals, reducing allergic reaction in your body, and then when the brain, I mean, is more clean and able to develop, come back to develop normally, then you can give something that is promoting the brain development. For example, the most useful nootropic in my experience is acetylcholine, which is a precursor of acetylcholine. Acetylcholine is working on areas of the brain which promoting language and the cognitive skills, understanding, learning. But because it's also activating the vagus nerve, have also anti-inflammatory effect. Okay, so it's for example helping to reduce the gut inflammation. So with this double effect, anti-inflammatory and promoting brain functions. Then there are different natural products like Bacopa, lion's mane, ashwagandha. There are specific products that are working on the receptor of acetylcholine, but also receptor of GABA, or receptor that are make inhibition of this glutamate overactivation. And there are some it's called neuropeptides, especially in Russia. There are many neuropeptides that can have more stimulating effect, like promoting the brain development, such as, for example, picamilon, no-pept. I don't know if you ever heard this, or they have cerebrolysine, they have this kind of product. Some of them I find very effective, like no-pept seems to be very effective product.
What experience do you have with cerebrolysine?
I have very short experience. I don't like so much because it's an injectable product. All the feedback I receive from patients that try that in Russia, because I've been working also in Russia and Ukraine, is not so exciting. No? So I would prefer to use something less invasive and more effective than the cerebrolysine.
But you think, because we were the other day discussing in one of the groups about, because the cerebrolysine, as you said, it needs to be injected. So we were wondering whether it could be administered via intranasal with a spray. Do you think that could have some sort of absorption that obviously wouldn't be the same?
Yeah, I use some. I don't have experience with cerebrolysine, but I have experience with the other nasal sprays, where suppose that the olfactory nerve is bringing the molecules directly in the brain, and they actually working very well. There is a product, it's called RG3 on the market. It contains red Korean ginseng, so it's extract of ginseng, which is used nasal, like as a nasal spray, and it's working very well on reducing level of brain inflammation. And that's also nootropic effect. It's feeding the neurons to work better. Or, for example, oxytocin.
Yes.
Syntocinon is a nasal spray produced by Novartis, I think. So it's used for treating pathological shyness when children are very shy, especially teenagers. So in our case, with low level of oxytocin, when they are, especially children, they are not interested in relationship at all, they are working increasing the social skills, social imitation, even spontaneous language. So the nasal way, I like that, especially in children when it's very difficult to give everything oral. That's a very good way to give something.
Would you think that the effects last, for example, with the oxytocin, or they need to keep on applying?
keep for enough time, then the effect became long term. They are not regressing.
Okay, so we were talking, so something, because you talk about nasal, so it made me think about stem cells for some reason, and then it made me think that one of the things I read about you, your collaborations with Dr. Bradstreet. So you did some work and some research on stem cells. What could you tell us about that?
Yeah, I had this privilege to work with Jeff Bradstreet. It was really a genius in the field of autism, and it's a pioneer of finding the right treatment for autism. For example, working with fecal transplantation children. He has been the first one that I heard talk about this. He has been using, for example, molecules like GcMAF, or the collaboration with Dr. Marco Ruggero in producing Rerum, and then Immuno is coming from his experience. Also working on cholinergic pathways, he has been the first to talk about that. Or other product like TSO. I published something about TSO after knowing about what he was doing, using parasites to feed the reducing that inflammation. Mm-hmm. So I've been really a pioneer for many things, and many things I'm doing, I've learned, is coming from the experience with him. Also stem cell he was very excited to use stem cell for children. I follow him. I had my experiences first of all in Kiev, then in Cancun, and then I have a patient that are doing Vienna or in Panama. To be honest, it was a little bit disappointing for me, all this experience. We published something, say that can be a very good tools to reduce inflammation, but then the level of improvement that I found was very disappointing. I mean, maybe 10% of children that have done stem cell, I can say, have a very, very good, effective, significant results. But the same results that I can see using, I don't know, IV chelation of hyperbaric chamber therapy or other more simple supplements. So at the moment, I think that's very good, can be very theoretically a very good treatment, but at the moment we don't have so much experience, or maybe the right way to use stem cell to have the most effective results. So they are very expensive, very invasive treatment, and the most of the time disappointing.
Okay, so following the subject.
At the moment, I'm not suggesting, I'm not recommending, and it could be the very last treatment that I can say.
You wouldn't think that applying stem cells, you would have to regulate the immune system and to lower inflammation. You haven't seen good results on that.
Yeah, that's theoretically what they should do, but I cannot say that I've seen that in many children.
Okay.
Let's say at course of hyperbaric chamber, I see improvement in 80% of children using that, or 80% of children using chelation see improvement. If I suggest something that give a result only to 1 out of 10 children, I would not do that.
Okay.
Especially knowing how much energy you have to invest in this kind of treatment.
So going back to Dr. Bradstreet and his research, so can we talk about GcMAF?
Yeah, GcMAF, it's a human-derived protein. So it's a protein that's normal in our body. But if you give a higher dose of this protein, that's have a fantastic anti-inflammatory effect on microglia, because GcMAF is a macrophage activator factor, which means that it's working on macrophages. And microglia, it's macrophages that when they move in the brain, they change the shape and became microglia, but they are still macrophages. So they are the first target of the GcMAF. If I can say what is the best effective treatment for brain inflammation, for sure it can be GcMAF. The effect, it can be immediate. I experienced 70% of children see improvement using GcMAF. But fortunately now it's it's not easy to find it, to use it, but fortunately, we have some synthetic GcMAF has been developed by Dr. Marco Ruggero, which is an Italian researcher who stays now in USA. We are very good friends. We are publishing also together, which is called, first was called Rerum, now it's called Immuno. And we can say, I can say that we can see the same effect of GcMAF using Immuno, which is just a combination of the active part of GcMAF, which is chondroitin sulfate, phospholipids, and vitamin D3. So that's,
oh, sorry.
Yeah, please.
One thing that I was going to say is, like, with the GcMAF, it seems to be, you talk to parents and some parents would swear by it. They would say that it's the best thing that ever happened. Some parents would say they notice anything. So how do you explain this huge difference between one and the other?
You know, it's in all the medicine that we can use, medicines. We have some people getting better, some people, they don't see anything, or maybe even side effect. It's difficult to say. When you make research for new medicine, we are never expecting that everyone will improve, for example, using a new anti-inflammatory medicine. We are already happy if we say 10% more than a medicine that we were already using for the same disorder. So for me, 70% of children see good results. It's already a huge result.
So you think GcMAF should be something that each parent should try?
Yeah,
give it a go.
I'm not recommending GcMAF, as I told you. There are some.
Oh, sorry, I meant.
Yeah.
No, I meant the product that you said that.
That's something definitely very safe and very effective to try. Yeah.
Okay.
And using practice. Yeah.
So now I have some questions that I've been sent to ask you. So one is, why is it that in the brain of autistic children there are more neurons?
Yeah, there is an explanation of that. Usually they say, the research on the brain tissue, they say we have less connectivity from the hemispheres and more production of the neurons and the local connection. The reason why this is happening, I think, is very likely linked to toxicity of mercury especially. So the mercury is reducing the capacity of neurons to produce very long nerves. So they are not able to make these long nerves from one side to the other side of the brain, and that's make the problem of a more complex function in children with autism. So it's like when you are pruning your fence, you cut something and they are growing.
Doctor, I'm losing you. Hold on. Can you hear me, doctor? I think we're experiencing some cat on the line. Let's see if we can get back the connection. Doctor? Hello? Oops. Great. So, doctor, let me ask you some questions that the parents have sent us. Why do you think, so this one, is the encephalitis autoimmune a possible cause of autism?
Yeah, I think there is some specific subset of children that are having autoimmune disorders. And you can have autoimmunity, for example, against some receptors that are overactivating this receptor and making children a very specific form of autism. You know, there is now this new this disease is called pandas of NAS, which is actually autoimmune disorder triggered by chronic infections. So they are very specific subset, and they need very specific form of treatment, which is not the usual one that you can find, you can use for the most of children with autism. It's not that easy to identify immediately those kind of children. And for these children, the best choice for sure for treatment is immunoglobulin IV, which is also not very easy to find a doctor available for that.
Okay. So what about, have you found any evidence that links between herpes virus and autism?
Some children can have, yes, activation of brain inflammation coming from DNA viruses like herpes viruses, herpes zoster, HHV6, for example. It's one of candidate of this kind of connection with autism. And usually this is happening because of production of autoimmunity as well. Cytomegalovirus, Epstein-Barr virus. Sometimes it's very useful to check how much these viruses are active in the blood with using PCR for these viruses. And some children are responding very well with antiviral treatment like baraciclovir or aciclovir. So when you're suspecting the children having, for example, herpes manifestation and they regress, that's one of the best choice for these kids.
Perfect. So, because I think time is ticking, so I'm just going to keep it short. Just to wrapping up this interview, what would you tell to those parents that have been given the diagnosis with very little hope?
Yeah, that's an important question. I want to say of this parent that please don't stop thinking what mainstream doctor told you, that autism is not treatable and you have to just give up to have a child with these chronic disabilities. Because children now, today, we know so many information, we have so many treatments that we can use, and children are curable. I have children that are completely recovered. I have more than 130 children completely recovered in my experience. Maybe I believe there are more, because some children, you just do something that you don't see anymore. And maybe they are just find the right way and they just are improved. So, and in my experience, 80% of children can improve. First target, first aim is to remove the pain from these children, because they are children, they are suffering, the most of them. Then the second aim, to improve language, cognitive skills, be more independent. So there is something that we can do. First of all, try to see which toxins they are exposed from food, for example, and try to already to work on diet, which is a gluten-free, casein-free diet. It's one of the best treatments. It's working in 90% of children. So if you see already improvement in diet, it means that some inflammation is happening in your body, in the body of your kids, and this can give you more courage to also discuss with your doctor what else you can do to treat inflammation of intoxication in these children.
Perfect. So for those parents that are listening and wondering if you accept families from abroad, because you're based in Italy, how would the parent get in contact? So if someone that is international wants to visit, would you do teleconferences? What languages are you able to speak, or what languages would you normally communicate?
Yeah, I mean, I'm already accepting patients from all over the world. Some of them, maybe it's not easy to meet. I have patients from, USA, from Sydney. So we just Skype for them. And we have any way to treat. I have, for example, a child completely recovered. I never seen them. So I just treat by by Skype. So we can in some way we can. It's possible to work. Of course, coming in my office is easier to make tests, to make more specific treatment. You can find information on my website. That's easy to contact my secretary and do the rest. I speak Italian, which with Spanish is almost understandable.
¿Castellano puedes hablar?
Exacto. Ne hablo español.
Well, Italiano, Castellano. So let's say that I'm sure you can manage with the Spanish, Italian, English.
I'm sure that it's easy also to learn if you stay just few days. Then English, a little bit of Russian, that's it. That's what I know.
A little bit of Russian, wow.
I've been working for many years, yeah, in Ukraine, in Russia, so I know something. Just listening. This is my interpreter speaking Russian.
Okay, so Doctor, thank you. Well, unless there is anything else that you want to add.
No, I hope I give good information to understand that the children, they are not just crazy. They have medical disorder, disease, and need to be treated. Try to do your best for the recovery of child, and any help I can have, I would be glad to support you.
Doctor, thank you very much. It's been an honor to have the opportunity to share this time with you. And just for those people that they are watching, please don't forget to like our videos and please to subscribe to our channel. Thank you very much, Doctor, and I hope to have this opportunity again. Adiós, muchas gracias. Bye.